Hello, Dr Dawn Harper. How are you?
I'm very good, thank you. How are you?
Yeah, not bad at all. Well, to be honest, I told my wife what the interview I was doing with you today, and she's going to be listening later intently because we've got big problems at home with this.
Okay.
Very big problems, to the point where I've got to ring the doctors later. Anyway.
Good.
So basically, 68% of Brits are unaware snoring can be a symptom of sleep apnea, potentially life-threatening. Hang on a minute. So if I'm snoring a lot and I'm possibly got sleep apnea, am I in danger then, doctor?
Well, if you're left untreated, yes. So I think we don't value sleep in the way we perhaps should here in the UK. I think we kind of champion the person who says that they only need 3 or 4 hours of sleep a night. Margaret Thatcher is an absolute classic. We all thought that was whatever we thought of her politics, we thought that was really good. You know, she could function on such little sleep. Whereas the person who says, look, I have to get my 8 hours, otherwise I can't function properly, we perhaps see in a slightly negative way. But we need sleep, and it's thought that we need between 7 and 9 hours sleep as an adult in order to recharge our mind and our body. And if we are chronically sleep deprived, which is the case in the silent disease, the condition called sleep apnea, if we get that chronic sleep deprivation, actually that increases our risk of some very serious health conditions, things like type 2 diabetes, heart disease, high blood pressure, even strokes. So I think we need to just change our mindset about sleep and start to take sleep more seriously. You referred to a survey conducted by Sunrise, who are the company that have developed this home testing sleep kit. And they were saying that actually all of these people, lots and lots of people are snoring, but even pre-COVID, 2/3 of people who were surveyed wouldn't have thought to discuss snoring or sleep problems with their GP. And that to me suggests that we're not taking sleep seriously enough. And actually we need to change that. We should be.
Let me give you a little snapshot of my life, if you don't mind. I'm going to talk personally here anyway. Basically, because I do a breakfast show, which means my alarm clock goes off at 4 a.m. So I go to bed, I try and go to bed about 8 o'clock at night. But when I wake up, I'm absolutely shattered. Like I've not had any sleep anyway. But then she will wake me up in the night. You know, go sleep in the spare room, go sleep downstairs, you're snoring, you're loud, turn over. So my sleep, what's the word I'm looking to use here, doctor? My sleep...
Your sleep bank is probably a little bit in deficit, isn't it?
Yeah, it's a mess.
So interestingly, sleep apnea, the symptoms often the individual will not necessarily be aware. And quite often I will get a relative who says, I'm really worried, you know, he stops breathing. This is more common in men than women, but women do get it as well. Whereas the person who shares your bed with you will say they stop breathing and then suddenly gasp for breath. And the patient themselves may not be aware. In fact, experts say that as many as 80% of people with sleep apnea are walking around with the condition and don't necessarily know. The symptoms that the individual might get, and actually that you've hinted at these, is that you wake up feeling fatigued. That's not right. You're supposed to wake up feeling refreshed and invigorated. You've given your body and your mind a rest. It's recharged and you're ready to face the day. If you're constantly waking feeling fatigued, that suggests that you're not getting quality sleep, and that could be a symptom of sleep apnea. Also, the person who feels they just can't concentrate or focus at work, or perhaps they're feeling like they're going to fall asleep, or sometimes they even do fall asleep at work. That's not right. And your doctor wants to know about that sort of thing, because it could be that is a symptom of sleep apnea. And long term, I mean, today, if somebody has sleep apnea, I'm afraid they are at risk of more severe disease from coronavirus. So it's very timely that we're talking about this. It is more common in men than women, and it is more common in people who are overweight. And we know that, you know, the health conditions I've talked about are worse with weight gain, but they're also worse specifically in patients with sleep apnea.
You see, I lost 5 stone about 2 years ago, and
wow,
yeah, 5 stone in 5 months. And I felt great for it, but I still snored, and I still did that gasp of air, which was a grunt, middle of the night, quite a few times in the night. What would somebody need to do then if they've lost a bit of weight or lost as much weight as they can manage, and they're doing everything they possibly can to fix this problem. Is there other things available? Medication?
Okay.
Well,
so, historically, to diagnose sleep apnea, we would invite you to come and spend a night in a sleep laboratory where we monitor you and observe your sleep and your brainwaves and so on, and we can then make a diagnosis of sleep apnea. Now, of course, during the pandemic, those facilities are temporarily closed, but Sunrise have developed a home sensor, and you have to purchase this at the moment. There are negotiations going on as to whether or not this might be available going forward on the NHS, which actually I think could be a huge game changer. But you can go onto the website and you order this sensor. It's £89, and it's like a little bean. It weighs 3 grams, and you just place it on your chin. And what that does is it monitors the movements of your jaw, which are linked to the movements of your airways. And it's actually been shown to be as accurate in terms of diagnosing sleep apnea as spending a night in a sleep laboratory, but obviously much simpler and easier in the comfort of your own home. So all of that data is transmitted down to an app, which is then analysed by sleep experts who can give you a full report and potentially make a diagnosis of sleep apnea. So I don't know, Darren, have you ever spent a night in a sleep laboratory?
No, I put something on my, is it my finger or my wrist or something?
Yes.
And then they told me to go away with that for a few nights. They analysed that at my local hospital, and they said, yes, you've got sleep apnea, you're going to need to wear a mask. I was 35 at the time. I'm now 40. I was 35 at the time, and I just met my wife. We were dating, and I thought, hang on, without sounding rude, I'm a virile 35 man. I'm not going to wear that in bed next to my new girlfriend. No way. And we're now here where we are.
It may well be worth your revisiting. I mean, the masks aren't nice, are they? They're called CPAP masks. A lot of people might be aware of them now because actually it's the type of mask that we use sometimes in hospital for patients with coronavirus. In the first wave, we were very much learning, and actually it seems that CPAP for coronavirus seems to be more effective than the conventional ventilation that you might associate with people with respiratory distress. So we are using CPAP for coronavirus patients, but we use home CPAP machines for people with sleep apnea. And as you say, they have to be fitted to you. A lot of my patients tell me they feel like they look like an elephant mask because you have this big tube coming down to help keep your airways open and make sure that you're getting enough oxygen into your lungs. But they take a bit of getting used to. I think most people would say they take a while to get used to. But actually, you might find now that your girlfriend is your wife and she doesn't like your snoring, she might accept that machine more readily.
Is the surgery available then for somebody with sleep apnea and the severe snoring?
Okay, so we don't treat sleep apnea per se with surgery, or do you mean the surgery as in your GP surgery?
No, so as in a procedure that you could go to the hospital for, yeah.
For snoring, sometimes we need to refer to an ENT specialist, an ear, nose and throat specialist, and they can sometimes do operations on the soft palate at the back of the throat. But that will all depend on the results of the tests that you have done. Sleep apnea, we encourage people where possible to lose weight, and hats off to you. 5 stone is a lot of weight to lose, and it's not easy to do, so well done you.
I'm going to be honest, it's gone back on though.
Often, and that is often the case, but there are some weight management services available now to try and help people to lose weight, because that does reduce your risk of sleep apnea. But absolutely, the CPAP machines are available on the NHS. So, it's just something that we need to take a little bit more seriously, because there are it's not just about perhaps giving your wife a disturbed night because you're snoring. It's about the impact of chronic sleep deprivation on both of you, actually, and what that can do to our mental and physical health.
Where can people find more about all of this that we've just been talking about, Doctor?
So on the Sunrise website, which is www.uk.sunrise-sleep.com.